So, to summarize the process of Wallerian degeneration, what is Wallerian degeneration? It is degeneration of the distal segment, the segment distal to the site of injury. Now, it begins within 24 hours of injury. And what are the different steps? Initially, the axon swells up and the terminal retracts from the target tissue, leading to paralysis of the target tissue. Eventually, the axon is broken down into small rodlets by the Schwann cells. The myelin is also broken down into lipid droplets by the Schwann cells. So what happens next? The Schwann cells multiply and enlarge. Why? Because they have to phagocytize the axon rodlets and the myelin. Now, this whole process of Wallerian degeneration takes about 5 to 8 weeks. And once the axon and the myelin are completely phagocytized, the ghost tube contracts. And this is why eventually when regeneration takes place, the diameter of the new axon is slightly lesser than that of the original axon. So what is retrograde degeneration? This refers to the degenerative changes in the proximal segment of the neuron, that is proximal to the site of injury. Now, one thing you must remember is, suppose this is the soma of the neuron and this is the axon. Now, let's imagine this is the site of injury and these are the regions of myelin, and in between you have the nodes of Ranvier. Now remember that Wallerian degeneration not only involves this distal segment, but also the first node of Ranvier on the proximal segment. So right from here to the end is Wallerian degeneration, whereas the rest of it, this part of the proximal segment, undergoes retrograde degeneration. So what are the changes seen in retrograde degeneration? The soma swells up and becomes more rounded. There is also swelling of the nucleus and it moves to the periphery of the cell. So it becomes eccentric in position. Also, eventually the Nissl granules disappear, what we refer to as chromatolysis. The process of regeneration actually begins quite early. It starts as early as the 4th day after injury, but then it becomes more pronounced after 30 days. Now, though the total time required for regeneration is variable, it requires a minimum of 6 weeks. Now, during regeneration, there is a lot of protein synthesis and repair. And this is facilitated by many nerve growth factors. So in the absence of these growth factors, regeneration cannot occur. Now we already saw that regeneration begins with the development of small sprouts from the proximal stump of the axon. Now initially there are many sprouts and they grow at variable rates, they elongate. So they form what is called as a growth cone. Now, how do these sprouts know in what direction to advance? This is facilitated by the Schwann cells. The Schwann cells align themselves along the ghost tube. So they form a sort of guide wire that directs the sprouts to elongate in this direction. So eventually, one of the sprouts manages to enter the ghost tube. So the other sprouts now degenerate. Now this sprout which has entered the ghost tube grows very slowly at the rate of 1 to 3 millimeters a day. Eventually it makes contact with the target tissue, and once that has happened, the axon is myelinated by the Schwann cells. The total duration is a minimum of 6 weeks. It depends on the severity of injury and could take much longer. Now, the earliest signs of recovery are centralization of the nucleus, meaning that the nucleus which was peripherally located in the soma again comes back to the center. Also, the Nissl granules reappear. So these are good signs. Now, there are two terms that you must be familiar with in the context of changes in the target tissue. Now, the first term is denervation hypersensitivity. What do we mean by this? So, at the time of nerve injury, we already saw that the axon terminal retracts from the target tissue. Now, the target tissue, therefore, experiences a reduction in the nerve signals. It is not receiving nerve signals anymore. And when we say nerve signals, we are essentially referring to the neurotransmitter signals. So when neurotransmitter signals are not being received, there is an upregulation of receptors in the target tissue. So for some time, the target tissue is highly sensitive to even small quantities of neurotransmitter that may be present in this region. You can see twitches in the muscle during this period. So this brief period of hypersensitivity is referred to as denervation hypersensitivity. But it disappears very quickly, leading to paralysis of the muscle. And this is what we call as the subsequent reaction of degeneration. Now, there are many factors which determine recovery after nerve injury. For instance, if the injury is a clean injury, the chances of recovery are much better when compared to a crush injury. Likewise, if the injury is associated with a lot of soft tissue injury, hematoma in the region, infections, or extensive scarring, the chances of recovery are slim. Also, if a nerve is injured in such a way that the two ends are more than 3 millimeters apart, then surgical intervention is required to facilitate recovery. Also, the distance of the site of injury from the soma matters. The closer an injury is to the soma, the lesser are the chances of recovery. This is because the soma plays a very important role in the regeneration process. Now, if it is a central nervous system injury, then the prognosis is much poorer when compared to an injury in the peripheral nervous system. Also, general factors matter. For example, an elderly patient may have a poorer chance of recovery. Diseases such as diabetes, hypertension, vascular disease, these can further complicate recovery. And finally, the type of nerve is also important. So sensory, motor, mixed nerves, these can all have different prognosis when it comes to recovery. So why is it that regeneration in the central nervous system is poorer than in the peripheral nervous system? Now, there are two important reasons for this. The first reason is that in the central nervous system, we don't have Schwann cells. So it is the microglia that phagocytize the degenerating axon and the myelin. But microglia tend to form extensive scars, and we know that scarring interferes with recovery. The second important reason is that in the central nervous system, it is the oligodendrocyte which myelinates the axons. And we already saw that one oligodendrocyte myelinates many axons. So unlike the Schwann cells, it is incapable of forming a guide wire for the axon sprout. So the chances of misdirected regeneration are much higher in the central nervous system. Now, a question that a patient with nerve injury would ask the doctor is, what are my chances of recovery? Everybody wants to know their prognosis. So there are some tests which can be used not only to diagnose nerve injury, but also to assess the prognosis. So let's look at these tests now. Now, the first test that we shall discuss is the electromyogram, the EMG. Now, though this test is used to make a diagnosis of nerve injury, it is more useful as a prognostic test. Typically, the test is done about 2 weeks after injury. Initially, because of Wallerian degeneration, we see small potentials referred to as fibrillation potentials in the EMG. But if regeneration takes place, these fibrillation potentials are replaced by what we call as re-innervation potentials. So once re-innervation potentials are visible, it means that regeneration is taking place. In other words, this test is of prognostic value. On the other hand, the nerve conduction velocity test is done much earlier. It is done about 1 week after injury. Now, the main relevance of this test is to differentiate between functional nerve injury and structural nerve injury, between neuropraxia and the other types of nerve injury. So what we do in this test is we record a compound action potential from the injured nerve. So we know that a compound action potential is the recording from the whole nerve, not from individual nerve fibers. So it represents the summated action potentials of the entire nerve. Now, if the compound action potential is preserved, then it means that there is no structural damage, there is no degeneration. So it is more likely to be neuropraxia. On the other hand, if you see that the amplitude of the compound action potential is reduced, it is suggestive of degeneration, that is a structural injury. So with that, we come to the end of this section. Thank you.